Electroencephalogram, also known as EEG, is a very useful clinical tool where electrodes are placed on the brain to measure the brain wave and the brain activity. Initially, when I was a med student, a junior doctor, SHO, and a junior registrar even, I thought EEG use was limited to detecting seizures, status epilepticus, and non-convulsive status, but it has a lot more use than that. The use of EEG in clinical practice can be categorized into 5 different categories. Number 1 is seizures. EEGs can diagnose whether there's underlying seizure activity, focal seizures, where in the brain it's arising from, generalized seizures, status epilepticus, non-convulsive status epilepticus, and complex partial status epilepticus. Number 2, EEGs can detect encephalitis. Encephalitis means inflammation of the brain tissue, which could be autoimmune, it could be bacterial or viral. EEGs go one step further and tell you what type of encephalitis. For example, the pattern is consistent with an autoimmune limbic encephalitis, HSV encephalitis. Thirdly is encephalopathy. Encephalopathy is the brain unhappy because of something else going on in the body. Broadly speaking, this could be due to organ failure, such as uremic encephalopathy from renal failure or hepatic encephalopathy from liver failure. Secondly, it could be from medication. And thirdly, it could be because of metabolic, such as an electrolyte disturbance, DKA, or HHS. So for example, you have a raised ammonia and you have a patient with liver disease and you're suspecting liver failure. An EEG will tell you that this is hepatic encephalopathy. For example, a patient with known paranoid schizophrenia on clozapine and haloperidol comes in with features of clozapine overdose. The EEG will tell you this looks like clozapine-induced encephalopathy. Very useful indeed. Fourthly, the EEG can give you a clue as to the underlying cerebral dysfunction, such as cerebral vascular disease, neurodegenerative disease such as prion disease, and a recent stroke, an infarct, or brain tumour. Very helpful in this context. Fifthly, EEGs are used as an adjunct in sleep disorders to help its diagnosis. Therefore, EEGs are a powerful clinical tool if used in the appropriate and correct clinical context. So go ahead, give it a go, practice. And don't forget to subscribe.